So now we will talk about the different types of endpoints in our study. And the first question is, was the primary endpoint appropriate for the study objective? And also, were secondary endpoint measured? If so, were they were adequate for what we was being studied or not? And so, was the method used to measure the primary endpoint appropriate? So, what is the primary endpoint? The primary endpoint is actually the outcome that you make the whole study for, that you make the sample size, you make your research question for. So, the primary endpoint, the question we should ask ourselves, what did the investigator measure to achieve the study objectives? And then the secondary endpoints are important but not considered to be the primary purpose of the study. For example, if I want to compare losartan versus captopril in the management of hypertension, the primary endpoint would be the systolic versus, or maybe the diastolic blood pressure. Secondary endpoints are like, for example, change in serum creatinine. They are important to know which one of these drugs make changes or elevate the serum creatinine, but it's not as important as the primary endpoint, the one that I made the study for. There are different types of endpoint. There are clinical versus surrogate, maybe versus quality of life. There are single versus composite, and there are primary versus secondary. And what I mean here, they are interchangeable. The primary endpoint could be clinical, single, and primary. Could be clinical, composite, and primary. Could be surrogate, composite, primary, or secondary, single, clinical, and so on. So they are interchangeable. There is no relation between its clinical and whether it's single or composite, and there is no relation between its single and whether it's a primary or secondary. For example, if I want to say change in LDL and change in serum creatinine, shall we consider this a primary or secondary? It might be a primary, it might be secondary. Shall we consider this clinical or surrogate? Because they are a lab result, so we consider them as a surrogate endpoint. So, what is composite endpoint and what is the difference between single and composite endpoint? Composite endpoint are a group of endpoint measured into primary endpoint. Usually consist of clinical outcome related to morbidity and mortality. And the rationale here is to measure the overall effect of the therapy since one specific outcome may not be enough. So, what do we mean by this? Composite endpoint is a collection of endpoints. Like, I don't want to, and this is mainly for the cardiovascular clinical trial. I don't want to measure stroke alone. For this drug, the incidence of stroke alone, or the incidence of MI alone, or the incidence of cardiovascular death alone. I want to measure the composite outcome of all of these. So the composite outcome is the combination of the outcome of stroke, the incidence of stroke, plus the incidence of MI, plus the incidence of cardiovascular related death. And this is the composite endpoint. Versus lowering cholesterol level. Lowering cholesterol level is a single endpoint because it's only one thing, and also it's a surrogate endpoint. So, example, after MI, a therapy is prescribed to reduce the incidence of multiple adverse outcome like reinfarction, death, and chest pain, and not just one clinical outcome. The result of individual components of the composite should be reported separately and analyzed. And this is so important in appraising any study. We should not consider only the composite endpoint, and we should also look for every single endpoint. And we will have a look in a minute on a paper to understand more. Okay. So this is the example. It was published in New England Journal of Medicine 1997. A comparison of low molecular weight heparin versus unfractionated heparin for unstable coronary artery disease, efficacy and safety of subcutaneous enoxaparin in non-Q wave coronary event study group. Again, check the title. What do you think of the title? And so on. So the endpoint of this example, the primary outcome of the trial was the composite triple endpoint. So it was a composite of three endpoints, which is death, and this is a clinical endpoint, and MI, which is clinical endpoint, and recurrent angina, which is again a clinical endpoint. So the composite endpoint is of these three at 14 days of follow-up. And then there was other secondary outcome, but we are focusing on the primary outcome, and it's after 14 days of follow-up. So let's check after 14 days of follow-up, the composite endpoint give me 0.02, which means there is a significant difference. What I mean here by significant difference is between the unfractionated heparin and the enoxaparin in the composite triple endpoint of death, MI, and recurrent angina. But they need to report as well the single endpoint. So what if we check every single endpoint? So if I check death alone, it gives me 0.92, which means no significant difference. That means no significant difference in death alone. MI 0.06, again it gives me no significant difference. Recurrent angina, and this one gave me significant difference. This should ring a bell. What we should know here, that although the composite endpoint is there is a significant difference in the composite endpoint, but in reporting every individual endpoint, it shows no significant. So you shouldn't look for the composite endpoint alone. You should also look for every single endpoint, because what is written mainly in the abstract is the composite endpoint alone. Okay, so they need a further research. The primary endpoint and other endpoint, they should be defined in an accurate way. What we mean here is they should say, for example, if they want to define acute renal failure, there are like 4 or 5 definition of acute renal failure. So they should say, we will take, for example, or we will consider this acute renal failure depending on the Kiduki guidelines for the American Kidney Foundation guidelines. For the heart, the hypertension, we will follow, for example, the American Heart Association guidelines, or we will follow other guidelines. So they should state clearly the definition of the disease and the definition of the endpoint, because it will affect the validity of the study. So we will do it in the class, and that's it for the endpoint.